Hi, my name's Talia Martin and this is my weekly one recording for primary survey and rapid trauma survey. And this is my patient for today, Beryl. So let's get started. So the first thing I'll be doing is scene size up. I'll be wearing my standard safety equipment, and appropriate PPE, personal protective equipment. So that'll be either gloves, gown, mask, eyewear, depending on the situation that I'll be going into. The next thing I'll be doing is checking for hazards. I can't see any hazards around. Asking, are there any hazards? No hazards can be identified. There's no hazards. The next thing I'll be doing is checking to make sure that there's only one patient. There is only one patient. Then asking, is there anyone else that is injured at the scene today? No, so this is my only patient. Now I'll be identifying the mechanism of the injury. Now my patient Beryl today has fallen down a flight of stairs. My ethane report would be, the exact location is 32 Wallaby Way, Sydney. The type of incident is a fall. My hazards, there is no hazards here. My access is really good. And the number of patients is 1, and I'll be calling for the highest possible clinical assistance for my. Next thing I'll be doing is initial assessment. So my general impression of my patient Beryl is that she's quite pale, a bit clammy. Her left leg is definitely broken. So those are my obvious signs and my general impressions. The next thing my patient Beryl does not have any catastrophic hemorrhage, so that is a good thing. The next thing I'll be doing is checking to see the alertness of my patient. Beryl, can you hear me? Yep, okay, so Beryl can hear me. She's alert, which is a good sign. She has stated that she had fallen down the stairs and she's in a lot of pain. Now, Beryl has spoken to me clearly, so I can now say that her airway, I don't think there's any blockage in it. I'm going to ask my partner, because I'm going to suspect there's a spinal injury from her fall from the stairs, to put her in a C-spine position, like so. Now I'll be checking my patient Beryl's breathing. So her breathing is normal. The rate is not fast or slow. And I'm just going to auscultate to make sure it sounds normal. Okay. Yep. So Beryl's breathing is normal. Next thing I'll be doing is checking Beryl's circulation. So capillary refill is good. It's less than 2 seconds. I'm going to be checking for a radial pulse, and it's normal. Now I'm going to be feeling Beryl's skin, and the temperature's good. It is normal. Now onto my rapid trauma survey. So I'm going to ask Beryl, can you tell me where it hurts? Okay, yeah. So she's saying that her left leg is in a lot of pain, and that's where she's feeling her pain. Okay, Beryl, I know you've got left pain, but I just need to check over everything just to make sure that everything's okay. Is that all good? Yep, and everything's all good. Okay, so I'm just going to check Beryl's head, doing a quick palpation, and her head's still hard, nothing abnormal. I'm then just going to check her neck just to make sure that there's no vein distension or tracheal deviation. There isn't any, so it's normal. Okay, so I'm going to be checking Beryl's chest now and auscultating in 4 places. Okay, everything sounds equal and none's different than the other. If it was unequal, however, I would percuss. So the next thing that I'll be doing is just checking for tenderness. Feel any tender there? Does it feel sore there at all? No, it's normal, which is good. Now I'm going to check Beryl's abdomen. Does it feel sore there, Beryl? Anywhere there? No, which is good. There's no any signs that there's any penetration that's happened to the abdominal area, so that's normal.
Then I move down to the pelvis area. Does it feel tender there at all, Beryl? No, which is good. It's normal. Okay, so the first thing that I'll be doing is checking the extremities. So I'm just touching Beryl's leg. Now I can clearly see that there's a deformity on Beryl's left leg. Does it feel sore there at all, Beryl? Can you push down for me? Yeah, push up. Okay. Now I'm checking the arms. Is there any tenderness there, Beryl? Tenderness there? No, can you push down? Push up? Okay, so Beryl's motor and sensory skills are good on both arms and her right leg. However, her left leg is obviously broken, so the motor sensory is obviously going to be out of whack. Okay, now I would grab my partner. I'd tell them to start observation. So there's obviously Beryl has a radial pulse. We've checked that previously. I then take her blood pressure, check her respiratory rate again, put a SpO2 pulse, check her SpO2, put a pulse oximeter on her finger, and yeah. Okay, so Beryl is talking to me fine and clearly, and she's alert and orientated. If she wasn't, however, and her mental status was altered, I'll be measuring her pupil size and reactivity, as well as the Glasgow GCS's, Glasgow Coma Scales. Thank you.